These are the important concepts in the whole respiratory system. I put them all together, and you know that this need to be covered very well. I summarized everything from the whole chapter and put it in 2 slides. So what's normadosis or normacidosis? That's a normal pH. What's a normal pH? So 7.4 plus or minus 5. Plus or minus 0.5. So it's 7.35 to 7.45 basically. Acidosis, decreased pH. Alkalosis, increased pH. Hypoxia, less oxygen, insufficient oxygen, low oxygen, whatever you want to call it. Edema, excessive accumulation of interstitial fluid. And we talked about that when we said that the fluids leave the capillary part, go in between the cells, which is the interstitial fluid, and it should go back from the venular side. If that didn't go back enough, it will accumulate, leading to edema. Epistaxis is a nose bleeding. Somebody's bleeding from the nose. Emphysema is a loss of elasticity. So you're destroying the alveolar wall. So elasticity is lost and the chest will be larger size. Pneumonia, acute inflammation of. Pneumonia is for the alveoli only. This is the lower part, for the alveoli. Anything above that will have the name bronchitis, bronchiolitis, tracheitis, pharyngitis, laryngitis. So everything starting from the nose, going down all the way, will have that name. I've been saying that it's okay if people, so now I will start looking at you. This specifically, please don't talk anymore. Okay? So pneumonia, anything above the alveoli will have the name of the inflamed part. Tracheitis, laryngitis, bronchitis, bronchiolitis, anything. But when you come to the alveoli, it's pneumonia. Okay? Rhinitis, inflammation of the nose. What's tracheitis? Trachea. What's laryngitis? Larynx, pharyngitis, pharynx, bronchioli, bronchioles. What's the inflammation or infection of the bronchioles? Just add itis at the end of anything. Bronchiolitis. Bronchiolitis. What's asthma? Is excessive stimulation and bronchoconstriction. That's enough to restrict the airway. You can't say asthma is bronchoconstriction. No, that's not true. Bronchoconstriction is bronchoconstriction. But if this bronchoconstriction is excessive stimulation, and it goes to the extent of severe restriction of the airflow, severe restriction. These people, if they have the asthmatic attack, the bronchi will constrict enough that they cannot breathe. They go like this. The air is struggling. You're struggling to pass the air within the bronchiole, so it's severe restriction. Severe restriction. Bronchitis is obviously inflammation of the bronchi. Eupnea versus apnea versus hypopnea versus hyperapnea. They all end with this part, right? Which means breathing. If you put EU, it means normal breathing. A means no, so no breathing, meaning you stop breathing. Hypopnea, less breathing. Hypopnea versus hyperapnea. Hypopnea versus hyperapnea. Increase versus decrease. What's apnea? Apnea when you stop breathing. Can you stop breathing? Yes. Not really stop breathing. The airways close for a few seconds and then it will open again. Did you hear about sleep apnea, or do you know somebody who's having sleep apnea? Sleep apnea is the wall collapse, close for some time, specifically when somebody lay on his back, supine position, and their wall is narrower. The wall of the respiratory airways is narrow, and weak, so it collapses. So they stop breathing for some time, and then when the oxygen saturation goes down, the brain will wake you up. So they go like, breathe, breathe, and then stop. And then they breathe, breathe. When they relax, fall asleep again, the airways close again. So no breathing for a few seconds until your brain wake you up. So people having sleep apnea, they wake up during the night every time they have this apnea. They wake up. So they can wake up 15 times, 20 times, 30 times, the number of the apneas. Hypercapnia means, what's capnia? Carbon dioxide. Okay, Dalton's law, Boyle's law, Henry's law, and Herring-Brewer's and Bohr effect. These are the 5 that we covered before. Okay, so these are the rest of the concepts that you need to know: eupnea, apnea, hyperapnea, hypopnea, hypercapnia, and then the laws and principles. Dalton's law, Boyle's law, Henry's law, Herring-Brewer reflex, and Bohr effect. And the Bohr effect is the effect of pH on hemoglobin saturation. You have 2 slides, memorize them, you know that it's important.